Hello everyone, happy evening, a very good evening. Am I audible and visible, everyone? Am I audible and visible, everyone? If you could give me a quick nod so that we can start with the discussion. All right, so happy evening, everyone. A very good evening. I hope and I believe all of you are doing well. And I know that all of you might not be doing a lot well also, considering that the centers that you guys have got, majority of the students have got the centers which were not expected. But, again, you are in so much of crucial time that you cannot afford to waste time. So, प्लीज डू नॉट बी इन एनी डिल्यूजन कि कुछ चेंज हो जाएगा. बेटर है कि पढ़ाई कर लो और एक अच्छा रैंक और स्कोर लेके आओ, ताकि यू गेट द चॉइस एटलीस्ट देयर you can fill up your choice and get your choice of the branch and the college. Otherwise, again, the rank and the scores should not compel you ki you have to take this college and you have to take this branch. So that is the only thing that you should be focusing on now, because I'm pretty sure that none of you, absolutely none of you, want to go through this harassment and the circus, all of it again. So make sure you are making the best of this. Please be done with all your the travel arrangements, the logistics and everything, and be done with it. And I would suggest that travel at least 2 days before your exam date, so that one day before you never know what's going to happen. It's always better that you are in that exam city center at least a couple of days before, so that you can settle down, and once you settle down, you can utilize that time that you get, the time that is spared for the last minute revision. Okay, so yeah, this class will be available later on also, guys. So those of you who want to watch this class as a recorded class later on, you can do that as well. And I hope all of you have got all of you had given the test. So this was the first mini test that we had, right? So instead of one grand test, we are giving it as 5 section tests. Okay, these are the mini tests, are actually the 40 questions that we are trying to do in 42 minutes. So rather than giving you one grand test and you investing your 3.5 hours of an entire day, you can finish off these 40 questions test. I'll be putting up the next test tomorrow, and we'll be having the discussion day after tomorrow. And for that, the discussion will happen for the next test. The discussion will happen in app, right? So it's gonna be a live class in the app. Okay, or so starting with the discussion, guys, without any further delay. So all the questions you could actually solve from the mnemonics and the tricks that we have discussed in all our short classes. Okay, and that all the tests are going to be free tests. Okay, and the discussions henceforth are going to be in app live for the subscribers. So at least everybody of you can give the test and you can assess yourself. The test will not have any explanations or solutions per se, but you can quickly go through the questions and assess your preparation. Okay, so you can give the test in Synapse by Dr. Nikita app, right, or you can give it on Synapse Academy website as well. Okay, you can give it either of that. Okay. Chalo, let's start with the discussion. Any other queries, I'll discuss it towards the end of the session. Now let's focus on the questions now. Okay, chalo. So sinus venosus does not receive blood. Okay, we are going to learn and revise a lot of tricks and mnemonics. So stay there, and we are going to do this quickly so that I know that every minute of yours is precious. And for this test, actually, a score which is 38 plus, I would count it as a very good score, because all the topics are the ones which are like must know. right? They are the must know topics, and if you have made mistakes, it's absolutely fine. Make sure you do not repeat that in the exam as well. Okay. So sinus venosus does not receive blood from, the answer here is going to be, what is going to be the answer here? The subcardinal vein. Remember, sinus venosus receives the blood from CUV. What is CUV? CUV is the common cardinal vein. Okay, the common cardinal vein, the umbilical vein, and the vitelline vein. Subcardinal vein, if I ask you that subcardinal vein forms what vein in the body? Yes, subcardinal vein forms what vein in the body? This is also your previously asked question. So we are side by side, we are going to see a lot of previously asked questions also. Subcardinal vein forms the predominant contribution to the renal vein. Okay, that's the renal vein. And what vein does the supracardinal vein form? There is this video in the app, guys, who have not seen that, venous system development, anatomy main videos, extra topics में है. जो supracardinal vein है, so imagine like if this is the body surface, पहले है उसके जस्ट अंदर supracardinal, फिर उसके अंदर subcardinal. तो जो बाहर की तरफ है, the intercostal arteries and the azygous system of vein, that comes from the supracardinal. Okay, remember that comes from supracardinal. Okay, and vitelline vein का mnemonic था vitelline, LIV, everything related to the liver, right? लिवर वाली जो वेन्स है, पोर्टल वेन है, स्फेनिक वेन है, सुपीरियर मेसेंटेरिक, ये जो लिवर से रिलेटेड है, that is going to be vitelline vein. Okay, that's going to be vitelline vein. All right. Going on to the next question, wrist joint is what kind of joint? Wrist joint is what kind of joint? So everybody knows the mnemonic. For those who don't, please remember this, that for your upper limb joints, the mnemonic is the palindrome, which is HEEH, H-E-E-H. You read it this way, you read it this way, it remains the same, right? So the wrist joint is, so starting with H, you start at the elbow, okay? So you have H, then comes the wrist, the E, and then this metacarpophalangeal E, and then the interphalangeal H, okay? So the sequence is elbow joint, then the wrist joint, then the metacarpophalangeal joint, and then the IP joints. Okay, so this is H, E, E, H, and that is why the answer becomes here, wrist joint is an ellipsoid joint. Okay, just remember this is H, E, E, H. Again, the topic of types of joints is something that has to be on the tip of your tongue, very, very important. Going to next one, which of this is an incorrect match, right? So you have to match the aortic arch derivatives with their respective vessels that you see here. So let us quickly see this. Okay, so it is third. Remember the third alphabet is C. So carotid is from the third arch. This is correct. Ductus arteriosus, asked in your last year exam as well. Ductus arteriosus is the left sixth arch. Very, very important. Remember number 6. Okay, remember number 6 and do it ulta. The mirror image of that, it becomes the D. So remember ductus arteriosus ulta 6, it is the 6th and it is left 6th arch. It connects the pulmonary artery and the aorta, which is present on the left side. Okay, so remember this is left 6th, not the right 6th. Okay, and patent ductus arteriosus we have seen in what congenital infection it is present? Patent ductus arteriosus, congenital rubella. Okay, very, very important. Congenital rubella has patent ductus arteriosus. And your 6th arch also contributes to the formation of the pulmonary artery. So remember the P and the D and the 6, all of these go together. Okay, all of this go together. Going to next one, subclavian artery, left 4th arch. Remember, it is only the right subclavian artery which gets a contribution from the aortic arch. Otherwise, the subclavian artery is the cervical intersegmental artery, the 7th one. So this is right subclavian artery. So it has to be the right 4th arch, not the left 4th arch. So this is incorrect here. Okay. And you remember it has 4 limbs. Okay. We have 4 limbs. So it is the left artery which comes from the 4th arch. If it was left 4th arch contributes to formation of, what does the left 4th arch contribute to the formation of? Yeah, just a minute. I'll just see the comments. Yeah, the left 4th arch is, left is the arch of aorta. Okay, that is the arch of aorta. That is what you need to remember here. Yeah. Next one is left 4th arch, arch of aorta. Remember 4 alphabets arch. It is the 4th arch. Going to next question here, predominant neurotransmitter in substantia nigra pars reticularis has been asked. So again, the topic from the short, that is the basal ganglia circuit that we have discussed. Remember the input, the main input in the basal ganglia circuit is what? What is the main input in the basal ganglia circuit? The main input, you know, जो टोल नाका वाला हमारा निमोनिक है कि जो मेन इनपुट है जो टोल नाका पे सब एंट्री देता है, that is the striatum, that is the caudate plus putamen forms the striatum, and the main output is the SNPR plus the GPI, globus pallidus interna. Okay, and remember that at majority of the places in the basal ganglia it is GABA which is the neurotransmitter. Where do you have glutamate? Remember glutamate, TATA. Glutamate is thalamus and subthalamus. Okay, thalamus and subthalamus has glutamate. Where do you have dopamine? Parkinson, substantia nigra, pars compacta. It is not pars reticulata, it is pars compacta. Okay, so remember that this is the output and you have GABA which comes here. Okay, it's going to be GABA. Going to next one, the volume of air remaining in lungs at the end of forceful expiration. Now remember, whatever remains in the lungs is something residual. So we have two residual things, that is residual volume and FRC. Forceful expiration bola hai, matlab jo which is not coming out even if you do a forceful expiration, that is going to be residual volume. FRC is something that remains at the end of normal expiration. Okay, it remains at the end of normal expiration. And can you measure this residual volume with spirometry? No, it cannot be measured with spirometry. So residual volume, right? So remember that residual volume, FRC, TLC cannot be measured. Okay, it cannot be measured with spirometry. Going to the next question, xanthurenic aciduria is seen in deficiency of vitamin. Your mnemonic here, X for X, that is vitamin B6, that is pyridoxal phosphate, pyridoxine. Okay, xanthurenic aciduria is seen in deficiency of it is seen in the deficiency of vitamin B6. Okay, very very important. Your kynurenine, xanthurenic, kynurenine वाला किसमें बनता है? कौन सा amino acid metabolism you have this kynurenine? Kynurenine, right? Remember that is tryptophan. Okay, that is tryptophan जहाँ पे kynurenine बनता है. Okay, right. Going to next one, apoprotein for chylomicron remnant. What is the trick that we have seen here? Remember, remnant is E. Okay, remnant is E. Replication, किसका replication में हमने E पढ़ा है? HBE antigen. That is hepatitis B virus का replication देखना है. So remember, replication E, remnant E. The answer here is going to be ApoE. Okay, that is ApoE. What is the only apoprotein for LDL? What is the only apoprotein for LDL? For LDL, it is ApoB100. Okay, remember it is ApoB100. So, LDL receptor defect, ApoB100, LDL is the one which contains cholesterol. So, remember hypercholesterolemia is LDL receptor defect, yeah, ApoB100 deficiency. Okay, clear with everyone? Yeah, so remember this is ApoE, very, very important. ApoA1 is the ApoA1 is for A1 quality का कौन सा lipoprotein है? A1 quality अच्छा वाला, healthy is HDL. Okay, that is HDL. Going to next one, cofactor for glutathione peroxidase. Remember another mnemonic here, glutathione, thighs. किसके thighs are perfect thighs? Selena Gomez. Okay, remember perfect thighs, perfect and beautiful thighs of Selena Gomez. So that is selenium. Okay, that is selenium. Very, very important. Okay. And next one, osteoporosis drug which acts by stimulating the osteoblast. That means it is stimulating the bone formation. Did we see in our recent in-app live class the bone formation wale markers? Bone formation ke markers, alkaline phosphatase. Then the next was osteo. What osteo? Osteocalcin. Okay, that was osteocalcin. And what was the next one that we had seen? Procollagen, yeah, telopeptide, which is the marker. Right, that is procollagen, which is a marker of bone formation. So remember here, the drug which acts by stimulating the osteoblast, the bone formation, is teriparatide. The mnemonic here is O-teri, surprising effect of a parathyroid hormone analog. Parathyroid we know causes bone resorption, but this one teriparatide, O-teri effect is surprising effect of parathyroid. Teriparatide causes the bone formation. Bisphosphonates act by inhibiting the resorption. Okay, they act by inhibiting the resorption. Okay, very, very important. Right. Going to next one, true about rivaroxaban. Remember, roxaban XA banning factor. That means it is factor 10 inhibitor, not the thrombin inhibitor. Right. So this option is gone. Factor 10A inhibitor. Remember, XX wale drugs. These are given orally, not parenterally. So the correct answer here will be this one. It is factor 10A inhibitor and it is given oral. Which is the oral direct thrombin inhibitor? That is dabigatran. Okay, remember that is dabigatran, thrombin antagonist. Dabigatran is given directly oral. Okay, so these comes under your NOACs. Okay, these come under NOACs, newer oral anticoagulants. Going to next one, drug of choice in hairy cell leukemia. Remember hairy, imagine a person who's so clad with hair, completely covered with hair. So remember it is clad, covered with hair. So it is going to be cladribine, which is going to be the drug of choice. Pentostatin is also another drug, but the drug of choice here is cladribine. Okay, that is cladribine, which is the drug of choice. And remember hair, what color hair was this? हमने जो mnemonic में देखा ये कौन से color का hair है? Red color. Why? To remember that it is affecting the red pulp of the spleen, not the white pulp. And what is the specific CD marker? Remember hair like this. This is the red hair, the face and the ear. CD103, very, very important. Okay, CD103. Annexin, what annexin is positive? Annexin A1, hairy is AI, that is A1, annexin A1 positive. Okay, annexin A1 positive. Great. Going to next one, all of the following anti-cancer drugs act on the S phase except. Now remember that in your exam, do not make silly mistakes of not reading the except and making a mistake, right? So what you can do is in the exam is you can actually use the cursor, the mouse to see that you are reading every word and you are reaching till the last word of the question. Okay, you can do that. Okay, so remember that S phase wale jo drugs hote hain, those are called as anti-metabolites. We have seen this. So this is required for DNA synthesis. Purine, pyrimidine, folic acid, methotrexate wala, whatever is inhibiting with interfering with purine, pyrimidine, folic acid, that is S. And remember that vincristine, what was the mnemonic? MTV. Remember MTV channel? That means on the M phase are the taxanes and the vinca alkaloids. So vinca alkaloids, they act on, right? Vinca alkaloids, they act on M phase, not on the S phase. What do vinca alkaloids do and what does paclitaxel do? Vinca, remember, inhibits the INC, inhibits the synthesis. Okay, the synthesis of the spindle, that is the polymerization is what it inhibits. Paclitaxel, PPP, promotes polymerization. It inhibits the disassembly. Remember that point. Okay. So, rest of them, methotrexate, dihydrofolate reductase inhibitor, right? Gemcitabine, fludarabine, all of these are like your purine, pyrimidine analogs wale. These act on the S phase. Okay. These are antimetabolites. Going to next one, which of these is an anti-inflammatory cytokine? Remember, it is interleukin 10, right? The rest of them, interleukin 1, TNF alpha, interleukin 6, you read as pyrogens. The endogenous pyrogens, this is anti-inflammatory. Remember, it as thus says bus. Bus karo inflammation, no more inflammation, that is anti-inflammatory. Which are the other anti-inflammatory? Interleukin और कौन से है anti-inflammatory? Interleukin 4 and also interleukin 13. Okay, so 4, 10, 13. Okay, 4, 10, 13. And what is the role of TGF beta? Remember FB, that means it stimulates fibrosis, and fibrosis means chronic inflammation. Okay, that is chronic inflammation. Fibrosis is chronic inflammation. Okay, Everybody is done with this. All these are very, very important questions. Quick revision of all the one-liners so that you do not make mistake in this in your exam. Okay. And which is the interleukin, which is the chemoattractant? Chemoattractant वाला कौन सा है? Chemotaxis करने वाला interleukin. Remember number 8. Imagine like these are two people के faces coming close together, attracting each other. So number 8 is a chemoattractant. Okay, that is chemoattractant, right? And in AKI, the recent medicine class we have seen kidney injury के marker. कौन सा interleukin है kidney injury वाला? That is interleukin 18. Okay, that is interleukin 18, right? Going to the next one, translocation 1418. You cannot forget this ever. The lymphomas ka translocation. Translocation 1418 is seen in follicular lymphoma. Remember, a 14-year-old sibling, what does it do to the 18-year-old? Follows. 14 follows 18. Okay, so remember follows is follicular lymphoma. Okay, follicular lymphoma. And what CD marker do you have in follicular lymphoma? FO is like 1. Okay, 1 and 0. It is CD10 positive. Okay, it is CD10 positive. Burkitt's lymphoma, B is number 8. Okay, remember like B is this number 8. It has translocation 814. Mental cell lymphoma, 11-year-old, 14-year-old keep fighting, make the parents go mental, and what do the parents say? You guys sucks. That is SOX 11 wala positive, right? And making the parents go mental, and the parents get the chakkar, cycling, goal ghumta hai. Remember, this is cyclin D1 overexpression. So cyclin D1 overexpression, SOX 11 positive, translocation 1114, that is all mental cell lymphoma. And very, very important, mental cell lymphoma ending in E, that is 5 number. It is CD5 positive, CD23 negative. CD5 positive, CD23 negative. Both positive is CLL. For that you do flow cytometry. Okay. I hope all of you remember this. Going to next one. X-linked recessive inheritance is seen with, you know, your 4 stories of the various inheritance patterns: dominant, recessive, autosomal, X-linked. So tell me, Huntington's disease का inheritance कैसा है? Huntington's disease. Remember Huntington is a dominant personality. Okay, it is a dominant personality who goes for hunting in a boxcar, puts the animal in the cage has 4 walls, right? Chromosome number 4. So this is autosomal dominant. Sickle cell anemia, remember CC side wala. These are autosomal recessive. All the CCC, these were your autosomal recessive. So C for cystic fibrosis, C for C, sickle cell anemia, another C for hemophilia C. Okay, remember hemophilia C, that is autosomal recessive. Hunter, this is a hunter who goes, what does he take for hunting? Axe. Hunter is axe, that is X-linked recessive. Okay, that is X-linked recessive. Which sphingolipidosis is X-linked recessive? Fabry's. Okay, so remember Fabry's is Fabric's. Okay, that is X-linked recessive. And albinism is autosomal recessive, which has tyrosinase enzyme deficiency. Majority of enzyme deficiencies, they are autosomal recessive. Okay, they are autosomal recessive. Okay, done with this? Yeah, Hunter's does not have a corneal clouding. What is the enzyme deficient in Hunter's, guys? Enzyme deficient in Hunter's is? Remember Hunter, T-E wala Hunter is iduronate sulfatase. Remember it is TT. Okay, Hunter is TT, iduronate sulfatase. Okay, iduronate sulfatase. Okay. Going to next one. Thyroid cancer. First tell me that all of you are with me and the speed is fine. Do you want me to go a bit faster or slower? Please also do let me know that as well. Is this fine with everyone? Yes? Okay. Faster? Okay, chalo. Let's go a bit faster. So, Thyroid cancer associated with RET. Okay, remember RET. RET is what chromosome? RET, T-E-R, that is chromosome number 10. Okay, RET is chromosome number 10 and men. Okay, 10 and men goes together. What men is RET? It is men 2. Remember 10 wala 2, T, chromosome 10, T2, men 2 goes together. And in men 2 you have med, that is medullary thyroid cancer. So remember it is medullary thyroid cancer which is associated with RET. And this is seen in men 2. What other tumor you have in men 2? Because this RET controls the neural crest cell migration. So neural crest cell, adrenal medulla. Remember medullary and medulla going together, adrenal medulla tumor, that is pheochromocytoma. Okay, that is pheochromocytoma. Going to the next one, all of the following are type 2 hypersensitivity reactions except, what was the trick here to remember in hypersensitivity? Short ke class mein dekha hai. Arthritis, wherever there is arthralgia, arthritis, remember it is hypersensitivity type 3. जैसे SLE में arthralgia होता है, arthritis, so that is going to be 3. Rheumatoid arthritis, arthralgia is going to be 3. While rheumatic fever is type 2 because it is antibody mediated. Okay, antibody mediated. So type 3 has systemic features like there is fever also which is present. So remember this is type 3. Okay, rheumatoid arthritis is type 3. Next one, which of the following does not act by increasing cyclic AMP? So what is the mnemonic for your cyclic AMP? Again, short ka topic. Cyclic AMP is CAMP, that is cholera, right? Then you have, what is A for? Anthrax. M for, what is M for? M ko aap turn karoge, M will become the E. So E. coli. Which E. coli is the cyclic AMP? Stable on the ground, labile in the air. Okay, stable on the ground, that is cyclic GMP. Labile wala is cyclic AMP. So remember that this heat is stable on the ground. That means this is cyclic GMP and not cyclic AMP. So that is going to be the answer here. So and P stands for pertussis. Okay, and this is labile. Okay, labile in the air. So heat stable toxin of E. coli, that is cyclic GMP and not cyclic AMP. Okay. Next one, McLeod medium is used for your culture media ke stories. McLeod Ganj mein kaun milta hai? The Dil wala story, the girl and the guy who fall in love on Tinder, right? And they meet in McLeod to tell you, I love you, right? Remember the Dil wala story, that is diphtheria. Okay. What does Tinder stand for? Tinsdale medium. Tinsdale medium. Tell you right medium. And where do they meet? McLeod Ganj. Okay, so remember this is diphtheria ki story. This is Corynebacterium diphtheria. Okay, Corynebacterium diphtheria. Not transmitted by Aedes mosquito. What is the trick for Aedes? Aedes. That is how you spell Aedes. A-Y-D-E-C-Z. Okay, rather than A-E. So Aedes, A for Aedes, yellow fever, dengue, chikungunya and Zika. Okay, all this is Aedes. So yellow fever, dengue, chikungunya. So what is the odd man out here? Bancroftian filariasis. Okay, Bancroftian filariasis is not going to be Aedes. Okay, very, very important. Going to the next question here. B red ulcer with granulation tissue rolled edge is seen with beefy red. Who loves the beef and the reed, the blood, khoon karaba? Dawn. Dawn loves the beef, right? So remember it is donovenosis. Okay, that is donovenosis. What is the other name for donovenosis? Remember dono, D-O has all the pseudo, bubo, pseudo groove sign. Why pseudo bubo? Because it's actually like a granuloma inguinale. Okay, that is granuloma inguinale caused by Calimatobacterium inguinale wala. So remember that is donovenosis. Okay, that is donovenosis. Going to next one, in direct ophthalmoscopy, how is the image? What is the mnemonic for that? Dev 15. Okay, that is Dev 15. That is direct is erect and virtual, and it is 15 times magnified. So it is going to be virtual and erect. Okay, it is erect and virtual. Which one is better? Which one has a lot of advantages? It gives you stereopsis, better field of view, right? All those advantages are seen with direct or indirect. indirect ophthalmoscopy has more advantages, right? It helps you see till the ora serrata, right? And then it gives you stereopsis also. You can see in the hazy media also, the illumination is better. What was the trick? How did we remember? Because it uses the support of the condensing lens. Okay, it uses the support of the condensing lens. Whenever you use somebody's support, you know, there are a lot of advantages, but the advantage here, magnification is less. Okay, the magnification is less. It is only 5x. I hope all of you remember that. Next one, in right-sided sixth nerve palsy, all of the following are seen except. When I say sixth nerve is gone, it is LR6, LR lateral rectus is gone. So when the lateral rectus is gone, abduction is gone. So the eye will be adducted towards the nose. Is esotropia, that is convergent squint, right? Eso towards the nose. So there is convergent squint because of the adducted eye. There is right-sided abduction loss. This is correct. Diplopia on dextroversion or head turned to left side. Now remember the rule of your paralysis here in the eye. Whatever muscle is paralyzed, if you ask the patient to do the action of that paralyzed muscle, that is when the diplopia will increase. So for the right lateral rectus, it is the dextroversion which is the function. So you ask the patient to do dextroversion, diplopia बढ़ जाएगा. Okay, so the diplopia will be there on dextroversion. The head will be turned not to left side. See, because of the lateral rectus gone, the patient cannot see this side of the field, right? And that is why if the eyes cannot see, the patient will turn the head so that he can see this side of the field. So the head will be turned to the right side, not to the left side. Okay, the head will be turned to the right side. Similarly, if I ask you that when there is superior oblique palsy, what feature the patient will have? The chin will be depressed or the chin will be elevated. What will you get that? क्या मिलेगा when there is superior oblique palsy? Chin depression or chin elevation? What does superior oblique does? Superior oblique does opposite action. Obliques do opposite action of their name. So superior will do depression. So when the superior oblique is gone, this is not getting depressed. So what will happen? The chin will depress. Okay, so remember there's going to be chin depression that will be present. Okay, the chin depression will be present. Okay. Going to next one, pH 7.2, bicarbonate 18, PCO2 30 is what kind of acid-base disorder? So when it is pH 7.2, that is 7.4 se come, this is acidosis. So you rule out the option of alkalosis and alkalosis, these two are gone. Now you have to decide respiratory or metabolic. Remember, respiratory Rome, respiratory opposite, metabolic equal. That means if the changes in bicarbonate and PCO2 are opposite to pH, then it is respiratory. So bicarbonate is decreased, 24 se kam hai. PCO2 is also decreased, 40 se kam hai. pH is also decreased. So all the three are decreased, all three going in same direction. Same is ME, that is metabolic acidosis. Okay, this is metabolic acidosis. So remember that when all the three go in the same direction, all three increased or all three decreased, it is metabolic disorder. pH increased alkalosis, pH decreased acidosis. Okay, so this is metabolic acidosis. Next one, what is the root value of the knee jerk reflex? I'm sure all of you would have remembered the rhyme here. 1, 2, buckle my shoe. We buckle the shoe at the ankle. So 1, 2 at the ankle, buckle my shoe. Remember this 1, 2 is S1, S2. Then comes 3, 4, clean the floor, right? On the knees, pocha marna, that is clean the floor. That is on the knees. But remember this is L3, L4, not S3, S4, right? Some of you might have made a mistake there. So remember at the kneecap. Okay, what is the dermatome also at the kneecap? That is L4. Okay, so this is L3, L4. Okay, this is not S3, S4. This is L3, L4. Okay, then you have 5, 6, pick up the sticks, biceps, C5, C6. Then 7, 8, shut the gate. That is triceps is 7, 8. Okay, C7, C8. Right. So this is knee reflex. Okay, that is knee reflex. Going to the next one, all these conditions can produce metabolic acidosis except which of the following? So किसमें नहीं दिखेगा metabolic acidosis? Logically thinking here, of course, the answer will be hypertrophic pyloric stenosis. Because here there is vomiting, and with vomiting the acid of the body goes out. Acid going out, so what remains in the body? Alkali. This will cause metabolic alkalosis. Hypokalemic, hypochloremic metabolic alkalosis with paradoxical aciduria. Diabetic ketoacidosis itself tells you it is acidosis. Salicylate tells you that it is salicylic acid, so it causes acidosis. And gastroenteritis, remember that is diarrhea, D for acidosis. Diarrhea causes acidosis. What acidosis? Nagma. Remember Nagma Didi, normal anion gap, Didi, diarrhea. Nagma Didi, diarrhea is normal anion gap, metabolic acidosis. Okay? Right? Can salicylates cause alkalosis? Yes. What alkalosis? Respiratory alkalosis. Because of the hyperventilation stimulating the respiratory center initially, they cause hyperventilation, respiratory alkalosis, and they have then metabolic acidosis. Okay, then there is metabolic acidosis. Correct. Not true about lateral medullary syndrome. That is, what is the name of lateral medullary? The Wallenberg syndrome. In the medulla, what cranial nerves arise? 9 to 12. Right? Remember, upper 4 midbrain, middle 4 pons, lower 4 is medulla. Now, out of that, which is the one which comes from the medial medulla? Remember the rule of 12. So, किसके टेबल में 12 आता है? 12 के टेबल में 12 आता है. So, medial medulla is 12. 9, 10, 11 is lateral medulla. So, when I say it is lateral medullary syndrome, it is the cranial nerve 9, 10, 11 gone. 12 is not affected. 12 is the hypoglossal. So, the tongue will be not affected. Okay, so first of all, remember, there will be no tongue atrophy or tongue deviation here in lateral medullary. Next, coming to the Horner syndrome, remember Horner's is sympathetic, S for S. Sympathetic runs on the side, that is laterally. Pain and temperature, remember SPT, spinothalamic tract, again on the side. SPT from the body and from the face. What carries the pain and temperature from the face? The trigeminal nerve. Okay, the trigeminal nerve is responsible. So remember that wherever the cranial nerve is gone, it is same side which is gone. So if you are talking about the sensations lost from the face, it is the same side, not the opposite side. But from the body, it is contralateral. From the face, it is ipsilateral. That is what you need to remember here. Because spinothalamic tract crosses at the spinal cord level, so it has already crossed. So the right side is actually getting the sensation from the left side. Okay. So remember, from the body, it is contralateral, but from the face, it is ipsilateral. And that is why this is incorrect statement here. Ipsilateral loss of gag reflex, again the cranial nerves, gag reflex में जो sensory होता है वो होता है 9, जो motor होता है वो होता है 10, right? So cranial nerves again same side, and there is going to be dysphagia. Okay, and there's going to be dysphagia. Is this clear with everyone? Yeah. So this was actually a tricky one, but again based on the very frequently asked topic. So the learning point here, you have to read the options very, very carefully. Okay, so this is contralateral loss of pain and temperature only from the body. From the face, it is the same side. Okay, from the face, it is same side. Is this clear with everyone? Yeah, very good. So you remember the mnemonic here? Pikachu. Pikachu is when there is pica artery, that is posterior inferior cerebellar artery, which is a branch of vertebral artery gone, that gives to the lateral medullary syndrome. There will be chewing problem that will be there. So pica causes chew, Pikachu. Okay, pica is Pikachu. Okay, next one. Not true about liddles. Liddles हमने कितनी बार डिस्कस किया recent MCQ marathon में. Remember liddles, Barters, Gittelmans, all of these go together. All of them have metabolic alkalosis. Okay, all of them have metabolic alkalosis, right? So it definitely does not have metabolic acidosis. Now liddles is a riddle. What is the riddle in the liddle? The riddle in the liddle is it has hypertension but no increase in aldosterone. Okay, whenever there is hypertension, we think that कि aldosterone hormone बढ़ा होगा, but इसमें aldosterone hormone बढ़ा हुआ नहीं है. So low aldosterone is there. So why there is hypertension? Because of the ENaC gain of function. Okay, the ENaC epithelial sodium channel gain of function, more sodium causing the hypertension, right? And this in turn, this is the action similar to aldosterone, the ENaC activation. So this causes low renin. Okay, this will cause low renin. Negative feedback. And remember, little dd. Little is autosomal dominant. Okay, Barter's and Gittelmans are recessive. Little's is autosomal dominant. Okay, is this clear with everyone? Remember, there is low renin, low aldosterone, and there is metabolic alkalosis. Is there hypokalemia or hyperkalemia in littles? Remember, alkalosis is all K loss. That means there is hypokalemia. Okay, there is hypokalemia, alkalosis. All K loss has alkalosis. Next one, dead or moribund patients are triaged under least priority. Dead है मतलब अभी आप कुछ नहीं कर सकते. Least मतलब black color. Okay. The highest priority here is the red color, where it is airway circulation like pneumothorax, cardiac tamponade, that will come under red. Okay, so remember this is black. Dead moribund is black. When standing on the right leg, if the left hip drops, what is it injury to? So remember, this is talking about Trendelenburg's. Trendelenburg's में क्या होता है? Opposite, OPS, OPS. Opposite drops. So if right side is affected, the left side will drop. If left side is affected, the right side will drop. When the patient is standing, remember standing, AN, on the abnormal side. On what side the patient stands is abnormal side. So the patient is standing on right and the left is dropping. That means it is the right side which is affected. So this is definitely not left side, not left side. It is right side. Now it is right superior gluteal nerve and not inferior, because it is the superior gluteal nerve which supplies the abductors of the hip that we are testing here. That is gluteus medius and gluteus minimus. Remember, gluteus maximus, max is ax, extensor. Okay, medius and minimus are your abductors. So remember, it is right-sided palsy. Okay, it is right-sided palsy. So next one here. All of the following are components of Hutchinson's triad, except Hutchinson's triad is seen in congenital syphilis. Bura mat suno, bura mat dekho, bura mat bolo. Remember, in the bura mat suno, in your congenital infections, all of them, it is SNHL. It is not conductive hearing loss. Okay, so it is not the conductive hearing loss, it is SNHL. Bura mat bolo, Hutchinson's teeth. It is not the mulberry molars. Also remember that. And bura mat dekho is interstitial keratitis, not uveitis, interstitial keratitis. Okay, so this is congenital syphilis. Am I audible now? Am I audible now? Yes. So till what point had you guys heard me? कहाँ तक सुना था? Was this done? The Hutchinson's triad? Okay, so we were coming to the next one, that is the Brenner's. Brenner's is rhyming with bladder, and remember, the bladder epithelium is a transitional epithelium. So remember, this is Am I audible now? Does this sound work? Am I audible now? Yes or no? Okay, that's great. I think this is the question that you might get in your exam, and this question is telling बार बार कि ना इतना चिल्ला के सबको मत बताओ this question, right? But less wise है, less wise क्यों है? बेटर है, सुनाई दे रहा है? अब तक शायद चिल्ला चिल्ला के आवाज़ आ रही थी. Do you want me to change the audio settings, guys? Better? Is it any better? Chalo, let's go on to the next one. Tell me, what kind of tumor is a granulosa cell tumor? Granulosa cell tumor? अरे फैन की भी आवाज़ आ रही है. एक मिनट, अब give me a minute, give me a minute. I think this should work now. Is it working now? Jana, my laptop is about to get conged off and it is not attached to the charger. So give me a minute, I'll be back. Just give me a minute. I think we are all set. That was a short break for you to come back. So Brenner, remember जिसने भी नहीं सुना Brenner और जिनको लग रहा है कि एग्जाम में आएगा, तो Brenner is rhyming with bladder. Bladder epithelium, transitional epithelium होता है, so transitional epithelial tumor भी बोलते हैं इसे. So it's a epithelial tumor. Germ, dysgerminoma is a germ cell tumor. Granulosa cell tumor is granulosa cell tumor. Granulosa is a supporting cell in the ovary. It is sex cord stromal cell tumor. Fibroma, thecoma, all these are sex cord stromal. Whatever is related to the pregnancy, the fetal development, it is a germ cell tumor. So placenta, choriocarcinoma. Then you have the yolk sac tumor. Then you have this, the germinoma, the dermoid, all the three germ layers. All this come from the germ cell. Okay, that is the germ cell tumor. बीच में voice cut हो रहा है. Don't know what to do with this. अभी भी कट हो रहा है. Is it any better? Hello. Is it? Hello everyone. Am I audible and visible now. I just wanted to complete those 7 questions. चलो, I tried something to fix something and it is back. अगर हो गया तो better है. Is it better, guys? Can we go ahead with discussion? Chalo. Whenever I say when we go ahead with discussion, this buffering thing starts.